This news story was produced by Cogeco North Bay News. To watch the full newscast, tune into channels 12 or 700 live at 5:30 p.m. Monday to Friday.
Up first tonight, it was practice under pressure for several nurses at the North Bay Regional Health Center on Thursday afternoon. The annual fire drill was staged, and it was the nurses' job to ensure their patients, actors and staged mannequins, made it out safe. Clarke Heipel reports.
This flashing red light signifies a fire in a patient's room. The alarm has been activated, and it's the job of the nurses of the ward to get the patients out of the ward into a predetermined gathering area. In this specific fire scenario, 10 patients require assistance, some represented as these mannequins and some real-life actors.
No, this is my room. No, I'm not going.
There's a fire in this room.
No, make them turn the noise off.
Okay.
I'm not leaving.
The nurses successfully evacuate all 10 patients in just over 5 minutes. Aidan West is the deputy fire warden of the North Bay Regional Health Center. He breaks down the exercise.
We run monthly fire drills in different areas of the hospital in order to test our fire response as per policy. So what happened today was we were doing our usual process of evaluating our fire response, and also if we had to facilitate an evacuation of a patient care unit. So what we had was we had some fake or mock-up patients that we used some staff members to represent patients. So those that were both bedridden, we had some in wheelchairs, and we had a couple that were resistant or may have some cognitive challenges and may be resistant to leaving the area. And we had a couple of our staff come and try to facilitate evacuating that space within the time frame that's allocated by the fire department.
Were you satisfied with the 5-minute and some odd second response time and evacuation time?
Yeah, absolutely. So as a requirement, when we submit to do these evacuations that are supervised by the fire department, we have to submit a process and a calculation that's done to determine the time frames. So we have 4.5 minutes to empty just the patient's bedroom, and we emptied the entire unit in 5:35. So I'm very satisfied that the response was effective and we were able to ensure the life safety of our patients.
Today's drill simulated a fire emergency. However, the skills used in today's drill can be applied to other real-life emergency situations.
Code red, evergreen launch, level
To the
100.
other side, okay?
Code red, evergreen launch, west end, level 100.
We have different codes, so for each situation we have a different code. So we have a fire code and we have an evacuation code, and that evacuation code could be used for triggered by a fire, triggered by a bomb threat, triggered by flooding, or some kind of chemical release within a given area that we want to get people away and ensure that people are maintained safe.
The North Bay Fire Department supervised the fire drill.
Now, the fire crews are here today for a very specific reason, because fire prevention officers are not going to be responding to the scene. The fire crews will be responding, so they need to review and see what's going on in-house and provide advice if necessary, because as they arrive on scene, they're going to stage their equipment and they're going to be looking for particular things. So if something doesn't quite work, they are going to give that input back to the building owner so that they can adjust their process.
If you are interested in watching Cogeco North Bay News, you can become a subscriber by calling 1-800-267-9000.